of healthcare, customized healthcare, genetic-specific risk factors, what are the predictions, what are the treatments that actually work better on certain portions of the population. This is the future of healthcare, and the VA is leading the way in the United States. 500,000 veterans signed up in this long-term million veteran program study. I'm not sure if the Hawaii VA has the ability for veterans to volunteer and sign up. We'll have to ask Dr. Ross if we have any participants.
You can ask me.
Oh, you're right here. Yeah, are we participating?
We are not yet. We have applied for it, but we've not been accepted yet.
We're working on it.
We are hoping.
Okay.
Yes.
That's right. You work in research. I remember. You're all the committee coordinator. And you do the newsletter.
That's it.
The quality newsletter. All right. I mentioned the study from Dr. Kaiser's group from IPHI about cancer care. They recently had a study done by the RAND Corporation, not the VA, comparing healthcare outcomes across the United States. It was a phenomenally good study as it relates to the VA, but a very underwhelming newspaper article title. So if you read the title, you'd say, oh, we did okay, because the title of the story was Quality of Care in VA Health System Compares Well to Other Health Settings. But if you actually read the article, you would note that on the 47 different outpatient measures that the study looked at, that the VA was better than the private sector on 45 out of the 47. And on the other two, we were tied. Phenomenally high quality care that the VA is delivering to its patient population. This isn't actually just new with the RAND study. They've been doing the studies and the qualitative and comparative metrics with outside the VA healthcare for a long time. HEDIS measures, ORIX measures, the CMS quality measures, Joint Commission reviews. The VA has consistently scored higher than the private sector. In fact, gold standard on many measures. We're the mark that the rest of healthcare is trying to catch up to. So you're doing a great job in providing quality care to our patients. Does the community know that? Does the United States citizens know what a great job the VA is doing in providing care? The RAND study just said 45 out of 47 measures, VA better than the private sector. What about suicide data? I actually got in trouble at my VA because I did the 22 push-up challenge. You know, they had that thing where, you drop and you do 22 push-ups for awareness, and they filmed it and they put it on our internet site, and the OPIA folks from VA, called and take that off of there. We're not supporting that message. But I'm not sure why. It was probably my bad form in doing the 22 push-ups. It wasn't a pretty sight. But the reality is it's a very nationally aware subject about how many veterans are killing themselves every day in the United States. And it is a tragedy. However, they have done studies to look at the likelihood of committing suicide. And did you know that for patients that get care in the VA, so not every veteran uses the VA. In fact, only about a third of all veterans actually use VA healthcare. Did you know that you're only half as likely to commit suicide as a veteran if you're getting care in the VA? So instead of 22 a day, it would be 44 a day if the VA wasn't here, making a difference, intervening, providing a difference. Half as likely to commit suicide if you're getting any care in the VA. If you're a female veteran, did you know that it's 10 times less likely that you would in fact commit suicide if you're getting health care in the VA system? So when the criticism is in our society, whoa, this is a terrible thing that's happening across our America with veterans, we need to do more. As a VA employee, you should say, that's absolutely right. You need to make sure that veteran is coming and getting care in the VA, because they're far less likely to kill themselves if they come and they get care in the VA. We are making a difference. What about hepatitis C? I mentioned my good news story that nobody came and watched. Did you know that, and I actually don't know the stats for Hawaii, I should have looked before the meeting. I know at my own medical center, 1,300 patients we've given the hepatitis C antiviral treatment that's a several weeks, very expensive. You know, it has a 90% cure rate. 90% cure rate for hepatitis C. And the VA has been administering massive amounts of hepatitis C treatment to veterans. I'm sure you're doing this here in Hawaii as well, and you have some good news stories where patients are being cured because they're going through this treatment for hepatitis C. We're also participating in the reduction of opioids. This is another national healthcare issue in America, where for years, for pain management and a variety of reasons, the healthcare system said, we're going to prescribe opioids to manage pain. And what they didn't realize was that if you put patients on higher dosage of opioids over time, that there were really negative consequences just about being on opioids. In fact, the number of accidental overdoses and deaths related to opioids is a national epidemic. And so the VA has said, you know what? We need to get on top of that. We need to participate in the solutions. We need to find different ways of appropriately managing pain for our patients. And so we've been on an endeavor to reduce the use of opioids across the VA. We're lowering the volume of opioids, or we're literally taking people off of opioids and doing other treatment strategies to try and help them with pain management. And since 2013, in the VA, a 22% reduction in opioid use. That's almost 1 in 4. We're no longer distributing. 22% reduction. There's a 32% reduction in the dosing. So that's even a bit, so even if we're still prescribing, it's a lower volume. As we're trying to do a patient safety initiative, this is actually still an important initiative. The Hawaii VA met its target of reducing opioid volume for high utilizers this last year, and the network has come and said we're going to do it again in 2017. We're going to do another 8% reduction in opioid use during 2017. I talked about homelessness and the 47% reduction. As a healthcare system, there's not many healthcare systems that actually would say that's any of our business. Why would, when somebody's sick and they come and we make them better, or we try and make them better, or we give them a treatment plan and hope they're going to get better, but whether they have a home or not, that's not even a healthcare system's job. Why would the VA be so worried about homelessness? There's a stat that they calculated in the United States about life expectancy. One variable makes a 30-year difference in how long someone is expected to live. Do you have a home, or do you not have a home? 30-year impact in life expectancy. What healthcare system wouldn't invest in making sure that its patients have a home? That's maybe more powerful than all of the treatment and the medications and whatnot. A 30-year difference. Do you have a home or not have a home? But the VA is a holistic healthcare system. A veteran's a veteran for life. You never unbecome a veteran. And so as a healthcare system, we take a holistic view of how do we make sure that we keep these people healthy and living. And part of that is making sure they have a home. That's why we're invested in that as a healthcare system, and why you should be proud to work for the VA, because we're making a profound impact. Those 500 veterans that are currently living in subsidized housing in Hawaii that were previously chronically homeless, they're thanking you, making a difference in their lives. The My VA Access Declaration, so the Undersecretary highlighted this as a major achievement. It actually makes some of us nervous, right? Because it says things like you're getting an appointment in primary care the same day, you get a same-day appointment in mental health, and we put it on our wall, and we've signed it, and it's visible. And so what's going to happen when the veteran walks in and reads it? Oh no, they're going to think they can get an appointment today, and we can't give them an appointment today, so we don't want to put the sign up. But it's pushing us as a healthcare system to do what's right. And that is provide timely unscheduled care. So in part of honoring the veteran is to say, you're in charge. We're going to be responsive to your needs. And so when a veteran says, you know what, I think I need to see the doctor, they don't have to wait until they get that recall card in the mail and then come back and months later. They might need to see the doctor sooner. And we have to figure out as a system how to be responsive to that so that we can meet unplanned healthcare needs. That's just appropriate. And so almost all of these My Access Declaration things, the nine statements that are on there, if you really read them, they're really about giving the power from the institution to the patient, letting the veteran be in charge of the healthcare system. And so it's a journey. If you read it very carefully, the first two words on the declaration are, we aspire. We're not there yet. It's not a perfect system, but this is the direction that we're going. And so we've committed as a healthcare system, we're going to listen to our patients and we're going to try and meet their needs. It's going to be tough on us sometimes to try and meet some of them, but that's where we're going. Let's see. Some things that he talked about, transparency of effort. I talked about sharing the appointment times. Choice authorizations have quadrupled. Now, some of you might say, oh, that's terrible. But the reality is, patients have a choice. If they're waiting too long, or if they want to opt, here in Hawaii, there's no waiting time, and you're eligible if you want to. If you want to leave the VA and go get care in the community, you can. Well, do you know quadrupling the number of appointments, the number of veterans that choose to get care in the community? I don't know the numbers here in Hawaii, so I'll tell you from my medical center. You'll have to extrapolate for yourselves. Probably similar. Last year, we did 26,000 choice appointments in the community. And we did 1.3 million inside of our own system. That's how many veterans were choosing to opt out of the VA and get their care in the community rather than get that high quality care that's still timely in the VA. It's just a fraction. It's a very, very small number, but it has quadrupled. Let's see. The Joint Commission, you know, when the VA was worried about all the publicity about access, we actually invited the Joint Commission to come in and inspect us. Not our triennial accreditation survey, but we said, you know what, let's just get an extra set of outside eyes to validate, are we providing timely care? And so the VA said, Joint Commission, can you please bring your specialists in voluntarily and inspect us and tell us how are we doing in providing timely access to patients? And the Joint Commission came. They came to all the VA medical centers. They did the review, and their final report said access to care in the VA is same, similar, or in sometimes better than private sector healthcare. That's the story. Now, that's not the story that gets out in the newspaper, but that's what the Joint Commission told us on their report. Let's see. Stat Level 1 consult. So stat consult means that you need it done right away. It's an emergency consult. Level 1 means it's in a clinical area that has some high urgency to it, like cardiology, neurology. Things like that are level 1 consults, and stat means it's an emergency. And the VA's system, back in, you can't really see that on the screen very well there, but back in November of last year, so almost a year ago, 56,000 of these stat level 1 consults in our computer system said they were greater than 30 days old. That's not good. Right? This is urgent stuff. This has to be done right away. And our own data in our computer system said we had 56,000 of them that were greater than 30 days old. Of course, a lot of those were the data doesn't actually tell an accurate story. We actually completed the work, but we forgot to tie the consult to the note, and so it's still open, and therefore it looks like we haven't done it, but we really have. Sometimes the ordering provider puts stat because they know how long it really takes, and so even though they don't need it urgently, they still need it sometime soon, and so they're just going to order it as stat. And so we had ordering discrepancies, we had conclusion discrepancies, but we also wanted to make sure we're not missing any patients. And so the VA has been working hard at reducing the stat level 1 consults. It was down to 6,000 when the slideshow was made in the summer. It's down to, I think, 3,000-ish now. So it's they've cut it from 56,000 down to 3,000 in the course of the last year. Same-day access declaration. So Hawaii is scheduled to do this in December. They're actually going to have the whole country make its confirmation public declaration that they're same-day access facility, meaning any patient can come in and get, if triaged, clinically appropriate, appointment that day if necessary. It doesn't mean a patient can walk up and say, I demand to see my doctor, and even if they're triaged and they don't need to see them, that they still get to that day. But it does mean if they do, they can at every medical center. And so you can see the growth across the VA in making that declaration this year. This is more of the stat consults and the improvement. One of the things they did is they changed the director's performance appraisal, which will trickle down to everyone else's performance appraisal at some level this year. And I really like the change they made. So they said, we're not going to measure wait times by numbers of days or what percent are within the clinically indicated or the desired date or the preferred date, all the math and all the numbers. They said, we don't care about any of that. You're going to be measured on what the veteran thinks. So we're going to ask the veteran, are you getting timely care? And if the veterans say yes, that's a plus. If they say no, you fail. So it doesn't matter all the numbers. You can't manipulate any numbers. There's no, waiting. If the patient population thinks they're getting care timely, you pass. If they don't think so, they totally empower the veteran to decide, are we providing timely care or not. You can see that there's been some modest improvement in those themes from veterans' perspectives over time. Here were the sites that were I'm sort of glad my VA wasn't on this list, and neither is the Hawaii VA, which is great. But these were the sites that had the worst care back in FY14. And you can see across the board, they're all making progress, both for routine and urgent care from the patient's perspective. So this isn't data about how long it's taking. This is literally asking the patient, the veterans, what do you think? And they're all improving. Video. So the last part the Undersecretary wanted to say is thank you for what you do. And I want to echo that. You don't get a ton of thanks as VA employees for the life-changing, high-quality work that you do on behalf of veterans. You're working hard. Sometimes it's in incredibly difficult circumstances. What I try and say is if it's going to be tough because we're the government and, it has government ease, make it tough on us, not on the patient. And so that's the champion work that you all have to do every day. If we have to fill out a form in triplicate and do this and do that, okay. But let's make it seamless, let's make it smooth for the veteran, and let's make sure that we're honoring them throughout that entire experience. And so thank you for doing that every day. I got one more slideshow. I'm going to be quick because I've only got 9 minutes to go. So this is all about how to rebuild trust with a veteran. I talked about the change in focus that the VA has, where it's instead of trying to measure itself on 4,000 different metrics that are internal, they really want to measure their success based on what veterans think. They're in charge, they're driving the ship, we are serving them. And so this survey is a survey that they're asking veterans, and they answer yes or no to this question, or agree or strongly agree or not agree. I trust VA to fulfill our country's commitment to veterans. Just that one statement. Do you agree? Do you not agree? Do you disagree? And you can see that back last December, so just a little over a year ago, less than half of the veterans answered that they agree, that they trust the VA to fulfill its commitment. And so we're working on trying to rebuild trust with veterans. And you can see that we're making progress. Actually, the latest data that just came out in November is that 61% of veterans answered that question. Yes, they do trust the VA to meet its commitment to veterans. Can you believe that? With all the national news, that more than 6 out of 10 veterans agree or strongly agree that they trust the VA to fulfill its commitment to veterans. That's what they're saying. So we still have work to do because 61% isn't where we want to be, but we're making progress. Are we solving the right problem, asking the right questions? This is really about how do you engage the veteran in solving the problem. Don't have us dream up how to make it a better system for veterans. Actually ask them. So they made a map, a journey map. Here's all the key points in a veteran's life. They left off the last one about dying, so the cemetery gets left out there a little bit. And they said, what can the VA do in each one of these moments in the life journey of someone that's sometimes yet to be a veteran? They're joining the military right at the start there, so they're going to be a veteran someday, all the way up to when they're facing the geriatric challenges and aging in life. What are the key points where the VA needs to make a difference? So they took each of these little bubbles and they broke it down. So here's when they're getting out of the military, and they broke down what are the needs that they have? Are they worried about a job? Are they worried about education? Worried about their family? Are they worried about health care? And so how do you break down all of those different components of what the veteran might be worried about and the points where the VA can make a difference? They're working on those strategically. They're also, so this picture is kind of the typical, let's say you're a veteran, you're trying to find the VA's website, or a website that tells you something about the VA because you want to learn. Well, the current reality is the poor veteran over there with the giant org chart full of computer options where they can guess. And the VA has partnered to make a new website called vets.gov. I don't know if you've actually gone, I want to encourage you to look at vets.gov. It's currently live, but it's still getting improved in real time because they're engaging with veterans. You can actually chat on vets.gov. You know, like you have like when you go to the airline or you're going to some site and you want to have an online chat with somebody that can help you. You can do that on vets.gov. And a real human is interacting with you as a veteran on the website. They're going to try and consolidate so that vets.gov is the one place to come to for the VA. I guess the little picture there is them chatting with one person. So where did we start? We had 3 different administrations, 524 websites. By the way, just this week, the 1-800 number went live here in Hawaii. The, what is it? The My VA 311. So it's 1-800-MY-VA-311. And you can actually connect to any VA in the country. So there is a decision tree after you get there, but you literally can dial that number from anywhere in the United States and eventually get to the Hawaii VA and get the decision tree about what buttons to push to get to the department that you want. One phone number for all of VA healthcare. We're still moving. I'm going to go quick because we've only got 5 minutes to go. So I want to just take a moment. A lot of focus on the veteran. And you might be sitting here thinking, that's great, but how about as an employer? What are y'all doing for me? What's the VA doing to help employees? And frankly, the answer is at a lot of levels, not enough. And you can't expect your workforce to be joyously serving veterans, inspired every day, if you don't treat them right, if you don't honor them, if you don't have a place where you can listen and hear their concerns. And so the VA's really next evolution needs to be, how do we make sure that our workforce is connected to the mission, is engaged, that we're meeting their needs, that we're meeting your needs in the healthcare system. And so I think you're going to see that a lot of the priorities about engagement, connection, are going to be focused on the staff. It's sort of like my husband's strategy, right? Happy wife, happy life. Well, in healthcare, in the VA, happy employees, good healthcare system. You can't undo that connection. It has to be that way. So I'll end with this quote. They ended with this quote. I've learned that people will forget what you said. You probably have already forgotten what I said. People forget what you did, but people will never forget how you made them feel. So make sure you go out, regardless of what you're going to say to the veterans that are out there, you can make a profound impact on somebody's life in our healthcare system. And in fact, even though there's 524 websites and however many phone numbers, when a veteran comes to the Pacific Island healthcare system and they stand in front of you, even if it's just in the lobby and you just happen to be walking by, you are the VA to that patient, to that veteran. And what you say and how you interact with them can have a profound impact. So you are the ambassador going out and being the VA to the eyes of the veteran. And you can do that, you can do it well. I want to encourage you guys. Thank you. I know that was a bit of an awkward town hall. There's a couple of minutes. Comments, questions, anybody, and I'm not sure if we can take questions on the video or not, probably not from the remote sites, but anybody here in the room, any comments about I call it the VA infomercial. Maybe it's an inspirational video about why you should be proud to work for the VA. But any comments or thoughts from anybody here in the room? A shy group? A thorough presentation? The sleep group?
Very uplifting.
Well, good.
Thank you.
Okay, glad to hear that part. Well, very good. It's been a joy to be here for a couple of weeks, you know, as the acting director, and I'm only here for a couple more weeks, so it's kind of come and go, and I'll barely introduce myself, and then, you know, the giant goodbye cake and all the gifts. No. But I was just joking about that part. But what I could tell right away is that I can see that there are frustrations here, there are challenges, but it's a committed group of folks. Actually, the whole Hawaiian community, as far as when I went to the events on Veterans Day and watched the rallying around, so many Hawaiians are veterans, so a bigger percent of the population in this state are veterans than almost any other state. And the community rallies around veterans, you rally around, let's make sure we're going to do right by the veterans. So we can overcome the challenges, we can be positive going forward, and you're going to do great things. So it's been an honor to be here serving with you. Thanks for coming today. Appreciate it.